For those of you who are awaiting test results for COVID-19, please check the Ministry of Health's online portal or the link on our website. Please note that our health unit staff will follow up with you to provide your results. And please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 8,386 individuals have been tested for COVID-19. Currently, we have 1,278 tests pending. I will now share the most current case counts. There are 60,772 confirmed cases of COVID-19 in Canada and 17,923 cases in Ontario. Chatham-Kent has 89 cases, and Sarnia-Lambton has reported 192 cases. Michigan now has 43,950 cases, with 9,394 cases being in Detroit. Today, we are reporting 656 cases of COVID-19 in our community, an increase of 15 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 210 cases have resolved, 15 people are in hospital. 16% of our cases are between the ages of 20 and 29 years, 15% are between the ages of 50 and 59 years, and 21% of our cases are 80 years and older. 41% are male, 58% are female, and 1% is unknown at this time. Our community has lost a total of 55 people to COVID-19. 41 deaths have occurred among residents in long-term care and retirement homes. Our health unit is working with 8 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headache. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex County has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. And please visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. I regret to report the loss of one more community member lost her life to COVID-19. A female in her 90s passed away yesterday. She was positive for COVID-19 and was a resident of a long-term care home. I share my condolences with the family and for the loss of their loved one. Our thoughts and prayers are with the family. The Windsor-Essex County Health Unit is joining many other communities across Canada in recognizing Emergency Preparedness Week, starting from May 3rd to May 9th, and Mental Health Week, May 4th to May 10th. We recognize that these 2 topics are very timely and very much interconnected with each other. Our community is currently facing with the pandemic. We're also potentially could face flooding in our region. A lot of people are experiencing anxiety and stress in the community. It can all lead to a significant impact on the mental health and well-being of anyone living in our community. In preparing for any kind of emergencies, whether we're talking about pandemic, flooding, or even some kind of mental health challenges that people are experiencing, we need to have a know the risks first. The first thing that we need to know is what kind of risks are we currently exposing ourselves to. With the pandemic, we know COVID-19 is out there. It is infecting our community, and what kind of risk it proposes, how it spreads among the community members, what precautions we need to know, and what is our action to prevent us from contracting COVID-19. So we need to know the risk. Then when we know the risk, we need to make a plan. The plan includes what to do in case of any of these emergency hit. What about our children? What is our plan if they're going to schools, if they're not going to school, if they're playing? What do we need to do with them? What is the plan for our pets? What is our plan for having enough medication if we need? Do we have any emergency medication at our home that we can use? Once we have that plan, we need to then prepare, making sure that you have all the tool, you have enough supplies, you have the 72-hour kit we always talk about in any type of these emergencies, ensuring that we have that. You need to stay informed. You need to stay up on top of all the information that is coming out as a result of this emergency, making sure that you have access to credible information to make sure that you are getting the information that you need to action your plan, whatever your plan is for that emergency. And last but not the least, you need to make sure that you are staying connected. It's important for you to stay connected, especially in this time, for the mental health and well-being of yourself and also for everyone else in the community. Thank you.
We'll now take questions from the media. We'll start with Windsor.
I'm okay for right now.
Okay. Windsor Star.
Yes, I'm just wondering, Doctor, if you've seen a rise in calls for management of mental health crises, or if you can speak on community agencies, any partners who have expressed that.
I think we did hear some calls for the tobacco cessation or smoking cessation calls over the weekend, and so that need is there. A lot of the mental health challenges are limited by the available services, and I think that's the time that many people may not even realize that they are experiencing some mental health challenges. So I think it's just about recognition first, is understanding and acknowledging those challenges, and reaching out to the service provider is also very important for everyone. I haven't heard specifically from any provider that they have seen an increase, but combining that with what is happening, especially with the stressors, some people have lost their jobs, some people are just unable to go outside. There are many things that are happening right now, and people need to be careful, and they need to be looking out for their own mental health and well-being. And some of those recommendations are to provide them with the tools that they can that can have a positive impact on their mental well-being.
Thank you.
Any questions from CBC?
Yes, good morning. What are the, how do you define someone is resolved? Is it that all of their symptoms are gone? Because I don't believe you do retest people.
So good. Yeah, so the criteria for someone to be resolved is anyone who has started showing symptoms, and where their symptoms were mild to moderate, and after 14 days they are symptom free, and that time that they can be considered as resolved. If, let's say, after 14 days they still have symptoms, then we wait until the symptoms are resolved, and then 48 hours after the symptoms is resolved, we consider them resolved. And again, those are all the cases that are mild to moderate and do not require any hospitalization. These are all the community cases that we are saying that the criteria for discharge or criteria for resolution.
When the two long-term care, I think it's two recently, that have gone from no outbreak back into outbreak, is it that those people have shown signs of having symptoms again, or are those new cases?
So it's a combination. Most of the time when we are testing these individuals, either it's because they're showing symptoms, or they were swabbed earlier and then the results came back after while they are symptomatic. But mostly the homes that are already tested anyone who is showing symptoms, they're immediately isolated and they were tested. And if the results come back, the definition for an outbreak has changed. One case constitutes an outbreak right now. So even if it's a resident or if it's a staff member, it'll be counted as an outbreak. And that's why the 2 homes are in outbreak or went back into outbreak.
Okay, thank you.
Any questions from Blackburn?
Yeah, the Ontario government yesterday came out and kind of applauded themselves, saying, they've made advancements in testing, they're reaching their goals, they're passing their goals, and yet we're still seeing a huge backlog in tests. I mean, where's the disconnect there?
So I think there's a lot of efforts that are being happening at the provincial level. I cannot speak for them, but what we can see is even with the number of testing that we are doing locally has increased significantly. We like to see the results coming back quickly. There's no doubt about it. I think that's the push that we have asked from the local perspective, because at the local level, it is important for us to get those results back, because then some of those results can be actioned immediately as needed. And if those results are delayed, it's a challenge. And those conversations are happening, and I'm sure that there are many levels of government, many agencies involved in ensuring that all of that happen in a timely manner. And if you're really looking from a process perspective, the time someone is swabbed, that specimen need to be shipped out to a lab, and the delay in shipping that specimen to a lab is also have to come into play. At the lab, they have to look at their capacity. These specimens need to be tested within 72 hours, or they have to stored in a refrigerator for later on testing. And if the lab have the capacity to test them within 72 hours, they keep it there. Otherwise, it is sent to another lab that has the capacity to test it. So again, it does require some logistics to make it all that happen. And then in the end, when it's tested, we need to get the results back. What is the mechanism in place to get those results, either through fax or some kind of an electronic system? All those things are right now is challenged because there are many labs involved now for the distribution. So yes, it all needs to be, the process needs to be streamlined, and a lot of people are working to make sure that it happens. Until that happens, we at the community, it'll be a challenge for us to get those results timely, and we want those results to come back to us within, I would say, less than 3 days or sooner.
What's the time frame right now? When are they coming back?
Right now, we're looking at least 6 to 7 days, but some of the high-risk population, for example, someone who's hospitalized in ICU or a healthcare worker, generally we are getting their results much quicker than that. But again, sometimes it's a hit and miss, and unless it's coded appropriately at the requisition, it may or may not be processed in that timely manner.
Any questions from CTV?
I got a couple. So yesterday, Doug Ford said all businesses should get ready to reopen. So I'm just wondering, what should local businesses be doing right now to get ready to get open?
So that's a good question. I think the first and foremost thing is the world, as we know, has changed significantly. And all these businesses need to, who may not be fit into the typical criteria of essential businesses, but they still need to get back. And the real challenge is, unless we completely remove all those restrictions of physical distancing and all the other requirements that we have in place, businesses need to look at ways to providing services or doing their business in a way which doesn't put public health at the risk. So some businesses, for example, if they're not directly linked with clients or people coming into their businesses, it may be easier for them to focus on how can they reorient their own business or work on their processes to protect their own employees from coming into contact with each other and still do the job that they need to do. For example, the manufacturing industry. They may not come in direct contact with the general public, but their staff are coming in contact with each other, what kind of system they need from an occupational health and safety perspective, what kind of system they need from a screening and triage perspective, that individuals can be identified if they have early symptoms, and then they can go to the assessment center if they require any further testing. What is the process in place to ensure that physical distancing can be maintained? Okay. And for some businesses, if physical distancing cannot be maintained, do they need any PPEs to make sure that people, if someone who eventually gets sick, is still not infect other people? And what are those systems looks like? So that's an example mainly from the businesses that do not interact directly with the clients. But for those businesses who interact directly with clients, what the new service model would look like. So I think right now it's the time that every businesses should take a pause, look at their practices, and try to make it operational based on the public health guidance, ensuring that they're not putting their employees at risk, they're not putting any general public at risk. And what does it look like? Some businesses will come up with their own plan without getting all those details, because the businesses know their own operations much better than anyone else. Like, I cannot go and tell them, you must do this. I can provide them with some high-level guidance document, and that's what we are hoping for. So we are looking forward to connect with our business community to provide some guidance on that. There's been some guidance document coming from the ministry as well, but trying to put things into perspective, and we'll work with them to provide those recommendations.
So should the businesses start contacting maybe you, or who would you direct these businesses that are on the verge of opening? Who should they contact?
So I think we were approached by the Chamber of Commerce yesterday as well to have that conversation going, and we'll try to work with them to provide those high-level guidance. I would say no, do not contact us at this stage, because I think there's a lot going on. But we will provide some of those details for sure for the businesses to try and look into creating or changing their operations to meet the needs and meet the expectation on the Emergency Protection and Civil Emergency Management and Civil Protection Act to continue with their operations.
Okay, one more if I may.
Sure.
Okay, this morning on AM 800 you talked about how, we don't have it totally under control, the virus, but we have somewhat of a semblance of control. And I'm just wondering, because you've directed a lot of resources towards this COVID thing, right? Every morning I see you guys are hard at work, so I'm curious, at some point, we're talking about businesses opening, will you reopen the health unit in terms of, the services that you had to shut down, in effect, to take care of COVID?
No, absolutely, and I think let's just be clear, in addition to COVID-19, any emergency services that the health unit provide, we are still providing that. We haven't cut down on those services. Some of those services are deferred, but those conversations are starting to happen that, how do we get back to our normalized operation too, and how do we resource appropriately? Because definitely when we redeployed all our staff to COVID response, we don't have staff to do some of the other work that we have deferred. How are we managing that? Do we have enough staffing to make sure that we have a good handle on COVID-19 case and contact management and everything else that's happening with, whether we're talking about long-term care home, migrant farm workers, homeless population, mental health, some of the work that we are doing with the municipalities and supporting some of the community, providing with some of the guidance to the businesses. So there's a lot of activity that we are involved with. And how do we resource it appropriately to still meet that expectation for the community, and then also go back to providing some of our routine care that we do in public health, which includes like all the other things such as vaccination. We know that it's very important, and we are working with some of our primary care provider to ensure that the children vaccination is continued. But what about our school-based immunization clinic? So we have to get back to that. We have to get back to our dental stuff. So all the dental stuff that we do, we have to do that. Some of the smoking cessation services right now, we are providing online a phone-in service, and then sending our nicotine replacement therapy to them directly. Some of the sexual health services that we provide here in our clinic. So there's a lot that we have to go back to, but it all depends on those conversations and where this COVID-19 is heading, and how we can appropriately resource it. Obviously, if we have more money, more funding, it's an easy decision. But it's obviously public health. We always struggle with the resources and trying to balance with the needs of the community. But we have to get back there. And some of these conversations we started internally. But a bigger conversation definitely needs to happen at the other levels of the government to make sure that we have appropriate resources to manage COVID-19 on one end, and also going back to what our typical role is in public health in ensuring, protecting, and promoting the health of our community.
Any questions from AM 800?
Yes. Yesterday I spoke to Ontario's Health Minister, Christine Elliott, and she noted, and this is what she said, that Windsor-Essex is actually doing worse than the provincial average. She had the statistic of 100,000 population, Windsor-Essex has 136.3 cases. The Ontario average is 108.9 per 100,000 population. Windsor-Essex is doing worse than the provincial average. Why do you think that is?
So we shared that same graph on our EPI summary Friday, and we shared that the week before. And when we made that comparison, we made the point that actually our case rate, the standardized case rate per 100,000 population, is much higher than the provincial average. So we made that comment. And some of the consideration that we made is obviously it has to look at, it was not broken down further by the population demographic or population distribution. So the age ranges, what's the average age looks like, what's the seniors population in our community looks like. So our seniors population in our community is much higher than the provincial average. So that's the first thing. And then you also have to look at our impact as the border town, and you have to also look at what is happening in Michigan. And many of the healthcare workers initially were a good number of them were working in Michigan. So some of these exposure that happened locally, which was very different than any other community who is not connected with a border town that has a much higher number of cases in a proximity. So there are a number of factors for sure, and I think the other piece is obviously it's our community is it took us a little bit of time to get into that mode of physical distancing and getting all those things in place. But right now it is there. We are still having case. We are not out of the woods yet. But yes, it is. The numbers speaks for itself. We shared that number for almost 2 weeks now, and we wanted everyone to know that we are higher than the provincial average, and it was shared at least twice in my presentation.
How concerning is that for you, given the fact that the province is the one that mandates, when businesses can reopen, but if we're doing worse than the provincial average, should we be slower when it comes to reopening?
Well, when you're looking at the provincial data, so obviously provincial data incorporates everyone who's living in the province. If you're comparing yourself with any major cities, like cities of our size, then I think it would be a relatively fair comparison. Even if we're looking at comparing ourselves with London, our case counts may be higher than London, which is, again, it's a concern, but we are a border town. They're not. And any other cities like Toronto, Ottawa, if you're looking at their numbers, they're much higher. So I think there are a number of things that come into play. It is a concern for our community, and that's why I think we have really emphasized the importance of all those public health measures, and we continue to do that every day. We are putting all those messages, being transparent, clearing, giving out the information that everyone needs to play their part. It's not us, it's a social responsibility. It's all of us doing our part to make sure that we get to a place where we should be.
Okay, thank you.
Any further questions from Windsorite?
Yeah, good morning. One thing we're seeing daily in the comments on this live stream are people asking for a breakdown of daily cases between community and long-term care. Is that something the health unit could start providing each day?
Well, we do provide our epi summary weekly. Providing that information every day may not be accurate because even we get the results late at times, and we do not have all the details to present a good summary. So that's why we wait for the weekend to provide those detailed breakdown of what is happening in the long-term care home, what is happening in the community, and all those details are shared at that time. I would prefer to use the same Friday model. And again, day-to-day variation, it really doesn't matter that much. It matters is the consistency. If we are consistently seeing a number of cases in the community, it is a concern. We need to bring those number of cases in the community down to zero. We need to make sure that the cases that we are seeing is either coming from a close contact. Again, that's something that we like to work on to make sure that all those contacts are not developing cases. So there are a number of things that need to happen to get a better handle on it. Other than that, it's just the number. And we should be looking and focusing more on the overall trend, which we share every week, which gives a much better, clear picture of what is happening in the community.
Any further questions from the Windsor Star?
Yes. Can you reiterate how opening a lab in Windsor to process local test results, it's not as easy as just snapping your fingers and setting one up?
Yeah, so I would admit that I'm not an expert in lab technology, so I can't even comment what kind of lab system that we need to have in place. Obviously, it requires a level 3 or level 4 lab, which currently do not exist in Windsor for various reasons, and I'm sure that the hospital and the universities, they are probably the one that are capable of maintaining and operating those labs. They will be in a better position to say what would it take. From our perspective, yeah, if we have a local lab, that would definitely help us avoiding some of the transit time and sending out the specimens. And then the other question would be, what would be the lab capacity, and would that be something that would be only serving Windsor and Essex? And so I don't have that answer, but I think the folks working in the hospital or the university who operates these labs, they can provide a much better answer than me.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
Would that is something you push for in the future, to have a public health lab here in Windsor? I know we've had one in the past, but obviously this shows a need for one here.
Can you repeat that? Sorry.
Would something like this, would you now push for to have a public health lab here in Windsor? I know we've had one in the past, but I think this situation shows that there could be a need for one.
Well, I guess the pandemic, when it's all over, we'll have to go back and look at what works and what systems we need to have in place to prepare for even if there's a second wave, or even for a new pandemic that may show up. We don't know. So we need to have to really look at what worked, what didn't work, and I think given the size of Windsor and Essex, I would be pushing for having something here, but some of those conversations would be will happen at the provincial level for sure, and I'm hoping that that will be given a consideration, given our unique location and the number of our population, to enable us to do a better job in testing individuals in a timely manner.